All right, so in this audio lecture, we're going to be discussing leukemia, another white blood cell disorder. And this, again, is going to revolve around cancer this time. So we saw that with lymphoma. Now in this one, we're going to see that rather than the infection occurring, or the cancer occurring in the lymph nodes, but rather it's going to be on the cells that produce leukocytes. And so this is going to be cancer of the leukocytes. So it's going to affect the progenitor cells specifically. Um, and so when cancer strikes leukocyte production sites, okay, then abnormal leukocytes are going to be the result. So we're going to say why that's important, and then when we get to diagnosing leukemia. But these cells are abnormal, right? They don't look normal. They don't function normal. They definitely don't have a pre-programmed clock telling them when to die. So they fail to die. This failure to die crowds the space, and so now the healthy cells do not have the capacity to get all the stuff that they need, and so what ends up happening is healthy cells are not produced, and then these sick cells are produced in high amounts, and they're allowed to live because they don't die. So this is the second most common blood cancer. Okay. It is the most common childhood cancer, and not just blood cancer, childhood cancer. So even though it affects 10 times more adults than children, okay, it preferentially affects men over women. Now, what are some of the causes of leukemia? Well, causes of leukemia can include exposure to chemicals, right? So smoking is one of those chemicals. Right? Virus infection, radiation, anything that is causing a mutating effect to the DNA, right? So that's considered a mutagen, right? Sorry, the hiccups. So then we have chemotherapy, which destroys healthy cells and sick cells. So part of the treatment might be chemotherapy for this, but when you're getting that chemotherapy, it might be inducing this as well. Disease conditions like trisomy 21 can make these individuals more susceptible towards developing leukemia. Immunodeficiency. So, like I've emphasized before, we have various immune cells, and so when these immune cells start to experience this dysfunction, we can get cancers forming as a result. Specifically, if we're going to affect white blood cells here, then the white blood cells don't have the capacity to attack the cells that are mutated, that are growing out of control. So we have four main types of leukemia. So these are the most common types. There's various types. These are the most common types. So acute lymphoblastic leukemia is primarily going to affect children. It is this is the reason why that leukemia is affecting children more, right? But the good news is that it responds well to therapy and it has a fairly good prognosis. Okay. So if we look at this slide here, you can see the red blood cells. These are lymphoblasts. Okay, so lymphocytes. Now remember that lymphocytes are going to be produced from lymphoblasts. Now we have acute myeloid leukemia, and so the myeloid cells, the names are all indicative of what precursor cell is responsible for producing cells, right? So if it's the myeloid, this is going to affect more general white blood cells and leukocytes. In addition, we're going to see it affect red blood cells and platelets as well. So it affects primarily adults. It responds well to treatment, and its prognosis is a little bit worse than lymphoblastic leukemia, probably because it affects less. Now we can have chronic lymphoid leukemia, which affects primarily adults, and it responds poorly to therapy. And so this is going to affect the lymphoid cells, so lymphoblastic cells as well. Okay. Patients live for several years after diagnosis, but it oftentimes results in mortality or fatality. Now, the last type is chronic myeloid leukemia. This is again going to affect primarily adults, so you can see why the leukemia rates are higher in adults, okay, because most of the conditions affect them. Okay. These respond poorly to chemotherapy, and so chemotherapy is not a particularly effective treatment for this chronic myeloid leukemia. And so, if we get a bone marrow transplant, um, sorry, we can target this issue. Okay? So we can start to address the leukemia, and so by replacing the bone marrow tissue, so allogenic is from the same species, and so if we replace it with a bone marrow sample from the same species, we could start to repopulate the immune system. Now, this is going to introduce some rejection problems, but we don't have to talk about that here. So, if you need a review on that, you can go to the rejection chapter and rejection chapter in chapter 2 to look at the maybe transplant versus host immune systems. So, in leukemia, you're going to have these generalized manifestations. So, a decreased blood cell count, red blood cells, white blood cells, platelets. These blood cells will probably be abnormally structured as well. So the cancer is not normal. It lacks a normal function. So it doesn't make sense that would be producing effective blood cells that are doing their job. Okay. Lymphadenopathy, so this is swelling of lymph nodes. We have joint swelling, bone pain, weight loss, anorexia, hepatomegaly, which is a term that is referring to the liver, so it's enlargement of the liver. Splenomegaly, which we've already seen is enlargement of the spleen. This is probably due to the hepatomegaly from the increased protein production. And the splenomegaly is from destruction of the abnormal blood cells. Okay. We can see central nervous system dysfunction as a manifestation as well. Now, to diagnose leukemia, obviously you need to have the history, the background, the physical examination. These blood smears and the CBC are going to probably tell you the most. So those blood smears will tell you if you have a higher incidence of abnormal blood cells, okay, and the complete blood cell count is actually going to be able to tell you what cells are affected. Right? And the last tool that you'll use for diagnosis, the probably most painful one is a bone marrow biopsy, where you extend a needle into the bone marrow and you take a sample of that marrow tissue. Okay, so the treatment of leukemia, this is going to be really two options. You can either use chemotherapy, which is the drugs that target every cell in our body, killing healthy and sick cells, and they're looking specifically for rapidly dividing cells. They're preferentially going to go to that site, so looking for the cancerous cells. But then bone marrow transplants, right? So which then we deal with the rejection therapies. And so if you need a review on that, go back. There's an audio lecture over chapter 2, rejection of transplants, or just go back to your textbook and look over that information. So until next time.